right, hi everybody, and thank you for that introduction. My name is David Griffith. I'm the Director of Programs and Outreach for the LGBT Elder Initiative. The LGBT Elder Initiative is a nonprofit here in Philadelphia that seeks to foster and advocate for resources, services, and institutions that are culturally competent, sensitive, and welcoming to the unique needs of LGBT older adults. And really seeks to bridge the divide between the Aging Services Network and communities of LGBT elders. And I'm going to talk about those communities, but I'm going to start off by talking a little bit about data. I'm a social worker. I'm not a big numbers guy, and I think that sometimes that we as activists and social justice people can kind of shy away from the numbers. But these numbers are important, and I'm going to talk about a couple of the reasons why. So first of all, data improves the way that we provide services and programs. So if I'm working at a senior center and I'm doing some sort of health programming for my seniors, I want to know not only was this program successful overall, but was it successful across demographics? Did lower income individuals have less impact from this program? Were there differences in the success of this program across race, across ethnicity, across age, across gender? And I can use that information to tailor stronger programs. Number two, data improves outreach. So if I'm trying to provide services for a certain community, I need to know, first of all, where those people live and where they access services. So if I'm doing something like HIV prevention, I need to know where in the city are people who are living with HIV living, where they're accessing services, where the highest rates of HIV prevalence are, because I'm going to use that all of that information to shape the way that I do this outreach and shape my programs. On a more macro level, data drives funding. So anyone who's ever written a grant before knows that the more you can quantify the size of your community and the specific needs of this community, the stronger your argument is going to be. And so when we want money to flow towards the individuals and the communities that we serve, we need to have the data to back up as a justification for that funding. And it's a very similar idea with policy, that data drives policy. So when we can show the size and scope and needs of our communities and any disparities in things like healthcare, housing, employment, lack of services and resources, we can use that to turn that into policy change. And we've seen that effectively done with lots of different communities. And we collect data on anything from age, race, ethnicity, place of birth, employment history, medical history, ability, all the way down the line. And yet nowhere at the local, state, or federal level are we asking questions about sexual orientation and gender identity. Instead, we ask questions like, are you male or are you female? Even though we know that there's a wide range of people who don't identify in either one of those checkboxes. We ask, are you married or are you single? Even though we know that even in a post-marriage equality world, there are a wide range of relationship types and family structures for queer people. And all of this, even though the research consistently shows that LGBT people, and LGBT older adults in particular, are a high-need population. Older adults who have faced many decades of discrimination, marginalization, stigmatization, all impacting the ways that they live. And yet our programs don't assess whether or not we're meeting the needs of this population. Our outreach efforts don't look at if we're successfully reaching these people, instead preferring to assume that we treat all people equally, which is actually treating all people with the assumption that they're straight. And we don't advocate, to the extent that we need to, for funding and policy changes that reflect the needs of members of these communities. There is some positive work that's being done. There are organizations like SAGE and the National Resource Center for LGBT Aging that have guides on how to collect this data and how to ask these questions. And states like New York and California that have recently passed legislation mandating that state agencies start asking these questions. And it's one of the top policy priorities for the LGBT Elder Initiative. But there's more work that we need to be doing, and there's work that we can all do regarding this. Looking at our own agencies of how are we asking questions, are we asking the right questions, how are we creating agency cultures that are inclusive and welcoming, because until we're counted, we don't count. We don't count in the way that we design and evaluate programs, we don't count in the ways that we conduct outreach into the community, we don't count when funding decisions are being made, and we don't count when policy decisions are being made. And we will continue not to count until we start to ask the right questions. Thank you very much.